I'm talking to Kim at the Goodfellow Symposium. Hi Kim, how are you? Thank you for chatting today. You've got a talk this afternoon about sleep. Can you tell us a little bit more about what you're talking about?
Absolutely. So the topic's on sleep, but it's actually on how we treat a particular sleep problem called sleep apnea. But I think one of the first things to talk about here right now for the audience that are going to be watching this is around the notion of how do we sleep. I think it's really important as a GP or primary healthcare professional that you think, well, my patient's here complaining of fatigue, or they're here with other problems that they've told me about. Is their lack of sleep or disturbed sleep part of that? So asking people about how they sleep is really important. And a lot of people often rationalise their poor sleep off as, well, I've got 3 kids, I expect to be tired, you know, I've worked shifts, well, there's no reason why I wouldn't be tired. And it's really important to actually think beyond that and not just take that at face value and think, well, what else could be going on here? One of the reasons that's important, particularly in the context of sleep apnea, which we know causes microarousals and people don't go into their deep sleep, and as a consequence end up with a lot of daytime sleepiness, is that can lead to accidents, particularly for drivers. Obviously, we're very keen to have our drivers alert. It can lead to poor cognitive function. It's not very good for you if you've fallen asleep in the middle of a meeting, especially if it's an important meeting. It's a bit poor from an employee perspective.
So it affects your life.
It affects your life, You're not as engaged in your social life, falling asleep in your dinner, falling asleep watching the telly. It also has consequences for your cardiac health. If you have shortened sleep, research has shown that it has consequences for your ability not to lose weight, lose weight. It's been correlated with things like diabetes, and obesity is very strongly linked with sleep apnea. So there's a lot of significance around being able to sleep well. There are all sorts of literature that show untreated sleep apnea, bad thing. And so, well, how do we treat it? Well, commonly the gold standard treatment is CPAP, which is a face mask that's attached to the face overnight, attached to a little device by the side of the bed that blows air in. It's a sealed mask. It can be a whole face, it can be a nose, or it can be just a little, they're called nasal pillows. However it's treated, CPAP is considered the way to splint the airway and stop it collapsing, and stopping the heroic snoring that is often the reason the patient has come to see you in the first place.
I can see a patient panicking when you're saying, oh, wear a mask with air blowing in overnight. How do you deal with that?
Good question. And so one of the studies that I've been involved in is actually asked patients how they manage their CPAP, because we've got lots and lots of literature about concern with underuse. Obviously, we don't want our patients to underuse this treatment. And a lot of the literature is concerned with the problems that people might have. So there's been studies around introducing humidification into the network so people don't end up with a dry mouth. Lots of research done around reconfiguring the masks so that they're comfortable. We've all got a slightly different face, so finding something that's going to fit is a real challenge. But what I was really interested in is, well, we're all about this, do as you're told and wear your CPAP mask, but how do the patients actually do that? How do they do it at home? And no one had actually asked patients, how do you do this?
Which is so important.
How do you succeed with this? And so one of the really important factors that came out in my study was how important patients' partners are. Obviously, they're the ones that have the experience of the heroic snoring and have the experience of when their partners stop breathing in the middle of the night, and, you know, pauses in their breathing. It's quite a frightening experience for partners. And so there we have someone that's already engaged in this whole process of needing to use CPAP because they're the ones that have listened to and lived with the person that has stopped breathing. The person who does the stopping of the breathing doesn't remember that because they're mostly asleep. You don't have any memory or cognition that you stopped breathing or that you were snoring like a train. So we've got these people in the patient's life who are ready-made partners in that whole care process.
Yeah.
And so one of the arguments we had following our study was that why not include these people as part of the care pathway? I think it's really important to acknowledge the fact that there are other people in a patient's life who have got an invested interest in that person managing something like CPAP. It's a challenging therapy. So the more people that you've got involved in that whole process, the better. And a lot of my participants talked about how it was a lot easier when both parties were on the same page in terms of how the machine worked and why it was important.
How noisy is the machine?
They vary.
Okay.
Some of the older versions can be quite noisy. If they have a leak, so if the mask slips during the night, they can make quite a loud blowing sound. So it's really important to have a patient's bed partner in particular on board with what is going on and why it's important, and to not just let them say, oh, well, I've done 3 hours, I'm taking it off. So, sweetie, put the mask back on.
You need it.
So it's not about having someone to coerce the patient, it's actually having someone to troubleshoot and work with the person with the sleep apnea, just like any patient partner dyad would in any other circumstance. Obviously, if you've got a less than functional relationship, you might not have quite so good an outcome. But in the main, couples work together on all their life's problems. Well, why not this one? And so it's, from my perspective, it makes sense to invite partners in and have them part of the consult process and the care process.
Sounds great. And so in terms of what people can take away from today, so obviously there's a whole lot of interest in the research out there, and also, you know, how we could be approaching our patients. So what are the key things? You've mentioned bringing up their sleep.
I think it's really important to have that in terms of a differential, to just think, how are you sleeping? It's a really easy question to ask. And if they give you information around their sleep not being as good as it could be, then the Epworth Sleepiness Score is a really simple tool. It's about 6 or 7 questions that you can ask your patient or have them quickly fill out. It's a score out of 24, and if they're scoring 12 or more, then you need to be thinking, well, what else is going on here? I need to refer on. Include family and whānau and partners, or whoever the patient says is important for them to have involved. And also acknowledge that using CPAP's not easy. Some people take to it like immediately, like a duck to water. Other people, it's going to be a period of time, months of them getting used to it and troubleshooting it. But also acknowledge that our patients, they're pretty smart. The people that I had in my study had some really innovative ways of working through the process and troubleshooting and making choices around why it was important for them and giving themselves motivation. So our patients are really smart, and to actually acknowledge that and encourage that is really important. I think we don't sometimes give our patients enough credit for being able to manage these complex treatments that we send them away with.
Oh, look, thank you, Kim. It's a fantastic topic, and I'm sure lots of people will love it this afternoon.
Thank you very much.